So the common types of weight loss medications fall into a few different categories. A lot of medications are intended to suppress appetite. They were stimulants, so many of you may have the experience of drinking a cup of coffee and not being hungry for a while, and there are drugs that act on those mechanisms and will suppress appetite for short periods of time. The main disadvantage is most of them kind of wear out after a while. If you drink coffee every morning for a few weeks, you may find that your appetite comes back. There are drugs that block nutrition or nutrient uptake, so there are fat absorption blockers. There are drugs that can lower or reduce the rate of absorption of carbohydrates. And then there are drugs that do multiple things. The hottest new drugs are these incretin-based drugs or GLP-1 receptor agonists. These are drugs that are injected and they mimic a normal compound that's produced in the upper part of the stomach. These drugs do a lot of things. They seem to go into the brain and they impact our sense of fullness. In many people who use them, they change the way we think about food, some of the feelings we even may have about food. These drugs make the stomach tighten down at the base, and it slows the release of nutrients out of the stomach into the intestine where they're absorbed, so we get full faster physically, and it changes how the insulin system works and makes the body a bit more sensitive and makes insulin a bit more available. Finally, there are some interesting drugs that are being used that basically take up space. They soak up water and essentially take up space and then slowly degrade. These are not used very often, but they're kind of rounding out the sense of what medicines are available.